So I will go ahead and we'll get our slides up.
All right. Can everybody see my screen? Are you guys looking at the presentation?
Yeah, it looks good. So Sophonie and I, we're interactive. We want to give everybody opportunity to like drop in the chat where you're tuning in from, what's your name, what's your pronoun. Like, I want to get to know who's in the room today.
Sorry if everybody is up north in the cold, but it is warm. It is nice and hot where I am today. Welcome, everyone. While everyone is dropping in the chat, we just want to share this fact with you. Did you know that 80% of what makes up our health is determined by factors outside of the hospital and the community? And the largest portion of that 80% are social determinants of health. So we'll talk a little bit more about that today. Welcome, welcome.
Oh, we got a relative of Emma Hall in the room. Hello. Benton Harbor is here. Grand Rapids, Detroit, Ferndale, Muskegon, Kalamazoo, Philadelphia.
Nice.
All right, cool, cool.
Thank you, everyone.
Thanks. So yes, we had a beautiful introduction of us being numbers people, but we also want to remind people that you got to read between the numbers. Sophonie and I, we're evaluators. I am a qualitative evaluator. Sophonie is quantitative, so she's more numbers person. But just as much as when we're a part of organizations and we have to report the numbers, we have to make sure that we're reading between the numbers and telling stories. The numbers don't tell us everything. So we'll just break it down. We'll talk about social determinants of health. I know we've touched on it a lot today, but we'll relate it to the community we're working in Berrien County. We serve a little bit of a sprinkling around Berrien County. Our service area is a little bit all over the place. We'll show some data, but we're gonna focus on how there are limitations in just looking at numbers. Also, if at any point you have a question, feel free to drop it in the chat. We're gonna have a couple points in here where we're gonna address some questions.
Thank you, Siobhan. So the first thing we want to do today is just welcome everyone to a community of learning. And so all that means is we're a group of people, we're like-minded, we share our values and beliefs, and we want to learn from one another. So as much as we hope that we can share something new with you all today, we also would love to learn from you guys. So like Siobhan said, we'll have some moments of interaction in our presentation, and we hope that you guys get loud in the chat. So the first thing we're going to do today, anytime you're in the community, there is something that you are uniquely known for, something that only you are good at, something that you're an expert at. So let me know in the chat, what do you bring to the table? So for example, to the community of learning, I bring some evaluation expertise. Siobhan brings her qualitative evaluation expertise. So let us know what's something that you're great at. What do you bring to the table?
And it doesn't have to be what your job description is. We all have many talents that don't go on our business cards. So just tell us what you're bringing. Yes.
The intersection of faith and mental health, and I bring joy. I love it.
Archives and genealogy research and connections.
So many
Ends, yeah.
Sharing resources and bringing people together. Awesome. Thank you. Spunk and fire. I love it. Really cool. Really cool.
Training, facilitator, educator, health equity, social justice, implicit bias. Wow. So this is great too, because look through the chat. If there's somebody in the chat that has some resources that your organization is in need of, that you're in need of in the work you're doing, you need to connect with somebody in here. This work, you can't do it on your own. It's all about partnerships. I know I've heard that already today.
Yeah.
Advocacy and empowerment. Awesome.
All right. Thank you, everyone. Please continue to drop in what you bring to the table, and we'll keep going.
I won't linger on this too much because I know we've heard a lot today about health equity and social determinants of health. So I'll just jump right in. There are 5 categories we can use to categorize the social determinants of health. We got education, access, and quality. So you could see that in, you're living in a community and you want to see quality education there. Healthcare and quality. We want quality healthcare accessible to everybody. Neighborhood and built environment. How many of you live in a neighborhood that could benefit from better sidewalks and it's winter weather, we got all those potholes coming up, better roads, the built environment, our parks maintained, how is our community looking? Social and community context, how about if there's discrimination in the police department, is there discrimination in the courts? What does social justice look like in your community? And then the economic stability. I hear over and over, it doesn't matter what community you're in, somebody's always there and says, we need more job opportunities, be it for young people, be it for people in general, be it for, you live in a community like ours where manufacturing left a lot of people without jobs. Job opportunities are so important. So these conditions, where we're born, where we grow, we live, we learn, we work and age, they influence our health outcomes. And we talked about health equity already, but how do you define health equity? Can you drop in the chat, what is health equity to you? Danielle says each person being able to get their individual needs met. Dr. Patterson says a space where we all get what we need in order to be our best and healthiest selves. Denise says giving people what they need to be successful and removing obstacles to doing so. Stephanie, accessibility as needed. Makisha, to have needs met despite where we start. These are great.
Really great answers.
Awesome. Okay. Well, there's always a formal definition of these things, but all of the definitions in the chat work just as well. I really want to encourage us to get in a practice of simplifying concepts, because something we've learned in this work is how we define health equity can be just as accurate and even more accessible than the formal definition that we may pass around to our organization to say, this is health equity, we should be doing this. So it's important, it's so important to have a shared language, shared definition as you tackle complex concepts like health equity, because there can be a breakdown in communication in trying to deliver these kinds of things and implement them. So that's all I wanted to say about that.
Okay, so thank you, Siobhan, for introducing or reintroducing health equity. I'm going to talk a little bit about health equity work at Spectrum Health Lakeland. So in 2020, Spectrum Health Lakeland made a commitment to decreasing health inequities and increasing racial justice. And the overarching goal was to measurably increase life expectancy for all communities that the organization serves. So we have 3 priorities in the system. The first is kind of an in-house priority. These are the things that we need to do to be better. So it's just increasing knowledge about some of these things, increasing partnerships, increasing governance within the organization, and these fall under what we call foundational building blocks for health equity. And the second and third priority, which are heart health and maternal infant health, these are targeted health outcomes. And in addition to the commitment that was made, there was also a $50 million endowment provided to do this work. So the health equity strategy consists of 9 priority areas, and this is built off of the framework for achieving health equity as designed by the Institute for Healthcare Improvement. And I'm not going to read through all 9 of them, but I do just want to highlight that the IHI has 5 priority areas, and the organization came up with 4 more. So we have 9, and we call it the IHI Plus framework because it is built off of that. But again, we won't go into too much details about what each priority area is, but we can provide you with more information about that if you are interested. So I want to talk about this image here on the right side of the screen. We call it the kaleidoscope, and it's a strategic framework that consists of 3 distinct but interconnected levels of intervention. So we have the individual level, the community level, and the society level. So at that first level, the individual level, you'll see interventions such as trying to get an individual access to food or housing. And at the community level, that's where we really address the social determinants of health. So we're looking at things such as, is there quality healthcare in the neighborhood? Are there grocery stores with fresh fruits and vegetables? And if not, how do we change that? And at the society level, the interventions here would be something like advocating for change in legislation, say for instance, affordable healthcare, because then that has longer term impact on the lives of individuals. So we are deploying these interventions thanks to diverse and strategic partnerships. And again, the goal is to eliminate health inequities in the communities that we serve.
Health equity and social determinants of health are deeply interconnected. Some social determinants of health coincide with interventions that can be made to address health equity. Just as our system began with the Institute for Healthcare Improvement framework, and then we made it an IHI Plus framework, our plan developed and we added 4 more priority areas. So while you're on this journey, you will adapt as you identify new interventions that suit the needs of your community and your work. And this work is tailored, so everyone's roadmap looks different. So just as like we started somewhere, we saw something that we could work with, and we've been adapting it as we go along. Are there any questions thus far as we move on? We've tried to give you a base before we jump deeper into the details of what we do with our work. Are there any questions?
One thing that I'm noticing with it having these levels, it's letting me know that this is going to be a journey, not just we're going to throw a Band-Aid on this and pray that it all works out, but that it's going to be this individualized thing, but that as I take it out into the community, it'll help them take their heartbeat for them to do their individual work to pour into the community, and then we get to move up to a societal level. So I think that's important to keep in mind, because we can get charged up and be ready, like, we want it changed now, and like it didn't break overnight, it's not going to get fixed overnight.
Absolutely. This work may outlive us, and accepting that at the front of it is important.
Awesome.
Thank you.
If you have any questions, please feel free to drop them in the chat. We'll have another opportunity to take questions and comments later. So now we're going to talk a little bit about the Center for Better Health, which has been called a cornerstone for health equity in Spectrum Health Lakeland. And the Center for Better Health is a facility that Siobhan and I work to evaluate. So we have some stats about the work that is being done so far. how it benefits the community, and how it is related to social determinants of health. So the Center for Better Health opened in downtown Benton Harbor in the fall of 2020 as a means to confront COVID-19 disparities. And to open, we received funding from the Michigan Coronavirus Task Force on Racial Disparities. And where the center is located, literally in the heart of downtown, it's really easily accessible to residents of the 49022. And that's important because that area has been identified with having greater health disparities and lower life expectancy compared to other cities and towns in Berrien County. So in addition to funding, we do also heavily rely on partnerships to allow to offer the services that we do offer at the center, and we do that at no cost to the community. So the center originally was only going to be open for 3 months because the money from that the coronavirus task force was set to run out December 2020. And but instead of closing after 3 months, the center stayed open, and that is due in part to additional funding from Spectrum Health Lakeland, and that was out of that $50 million endowment fund. So we've been able to continue our work at the center even till today.
We are at the beginning stages of the long road ahead of us, this long-term work. Just to touch on some of the services offered: health screenings and coaching, cardiovascular appointments, physical health teletherapy, mental health teletherapy, social navigation, legal aid. And I just want to reiterate over and over again that we cannot do all this work without partnerships. We're partnering with Infinity Counseling, we're partnering with legal aid, emergency shelter services, Michigan Works, all kinds of organizations, people that offer help with getting people fresh food and vegetables. And the positive outcomes we've seen, or I would say accomplishments we can note to date, are we didn't have an on-staff cardiologist, and now we have a cardiologist who's there, who's Black. He looks like the community we're serving. We have a robust collaborative care model where we're combining physical and mental health. Sophonie and I, we've been doing this reporting of quantitative and qualitative data, and we're constantly adjusting the way that we're analyzing the work being done so that we can figure out how we can do the work better at the center. Are we serving the clients in the ways that they need service? So we're doing our best to put health equity into practice. We've heard some positive patient stories. We are expanding the center and thinking about what services we can expand to do even more in the community we're serving. So I just wanted to share some of those things.
And now we'll get into the statistics. We don't touch on the quantitative data so much because the mixed methods approach really is the richest form of evaluation that we have found. But I think it is important that we do show the traffic in the center over the first year. So this graph is showing total visits, which is indicated by the line here, and new clients, which are indicated by the bars. And these are for each month between the month of November 2020 and December 2021. And so it's showing us a lot, right? But I think what we can see immediately is that there are highs and lows in the number of people coming into the center. There are more highs than lows, which is important to call out. And as of April 2021, the numbers are just getting higher and higher and higher. Of course, there is a drop off, and that is due in part to winter, but there are some other factors as to why there was a drop off as well. And we will get to touch a little bit about that, but it is important to just have both that quantitative piece and the qualitative piece, because someone could look at this and be like, oh yeah, like the work that you're doing at the center is perfect. It's literally what everybody needs, but that's hard to tell by a graph like this, which is why we need to do that deeper dive to really find out what is keeping our clients coming back in and what is bringing new people in as well. So we have learned a lot in our first year. And so as we move forward, in a couple slides, we'll do a little activity where we talk about key programs at the center, and we'll talk about some strengths and opportunities that Siobhan and I identified. One of the awesome things that we do at the center is, again, offer that collaborative care model that Siobhan mentioned. And that's where we are able to offer both physical health and mental health. With, sometimes that's not something you see in a clinic. So we have been fortunate to do that. And again, that's through partnerships. And I will say, over the first year, the center offers over 700 mental health visits, which is awesome. And data that we received from clients highlighted depression, anxiety, and stress as the top 3 concerns for seeking mental health therapy.
On the graph on the right, it's a peculiar graph, but I'll break it down for you. So like I said, I do qualitative analysis. It means I'm interviewing people and asking them about their experiences, and then comparing that to the numbers with Sophonie and what she's found. So something I did was I interviewed mental health clinicians, and each row represents a conversation I had with a clinician. And then each column is something that was identified that they've seen in their clients. The majority of people said they saw anxiety, and you'll see that depression is the second more popular thing someone said. And I just want to also, again, reiterate that, like, we know that social determinants of health and mental health are so intertwined. And as we've heard in these conversations today about trauma, historical trauma, if a person is experiencing gaps in their social needs, it's safe to assume that there are some mental health interventions that can be offered to that individual. I mean, I learned about ACEs through Tasha Turner, or adverse childhood experiences. And if somebody has grown up with ACEs and then they're, as an adult, experiencing gaps in social needs, they need that mental health support. So it's so important to offer the wraparound services when we're doing this work, trying to address social determinants of health.
All right, so this is an activity where we invite you all to participate. Again, we'll talk about key programs at the center. We'll give you a little scenario. We'll talk about how it works at the center. And then we're gonna ask you to drop your perceived strengths and opportunities for that particular program in the chat.
So the SARA program, I saw in the chat earlier, I think it was Emma said she works with the SARA program. So SARA stands for COVID Emergency Rental Assistance. The Michigan State Housing Development Authority has federal funds available to help tenants facing pandemic-related hardships avoid eviction, while also ensuring landlords can recoup owed rent through the SARA program. The funds are administered through local nonprofit agencies. In Barron County, we've partnered with Emergency Shelter Services. They're the ones that have been dispersing the funds. And it's alleviating burdens for community members, whether it's housing or utility costs. Now, the process is you have to fill out an application, and something the center does is our staff, they help people fill out their application and make photocopies, get their paperwork in order. And once it's submitted, it can take up to 90 days to process and for the funds to be paid out. So if you could drop in the chat based on what I've said, what are some perceived strengths or weaknesses that you can see just from hearing about this program and the process? What do you think that's good about it? What do you think that needs improvement? Strength, free rental assistance. Weakness, time to get assistance. Yeah. Some people need help filling out application. Yep. Any others? No pressure. Well, go ahead and keep answering. I'll just jump into the strength judgment that comes with the need. That's a good one. Weakness, access to information in a timely manner if they are not tech savvy. Locating safe and affordable housing. Limited internet access makes it difficult for some to apply. That's great. Okay, so strengths we saw were, yes, we're meeting an individual need. We're helping people get their rent paid and utilities paid during a pandemic, which there are a lot of people that experienced hardship during the pandemic, and they needed something like this to help get off their feet. And it is good that if you submit an application for rent assistance 1 month, that if you have to wait up to those 90 days, the SARA program will cover your rent payment during the time you waited. So if I waited up to 3 months, I will get rent paid for 3 months worth of bills. So that's a good thing they factored into the program. However, some opportunities that we saw is, like I saw already in the chat, it's a long wait time. The approval process takes a long time, and not everyone's landlord is reasonable and willing to wait it out, or even willing to work with an individual. And it's really scary when somebody is threatening to evict you, and you have no other places to go or other solutions. So this is a temporary solution for a long-term problem. And situation we find that our staff employees are in at the center is that they're in the middle in trying to help people complete and submit their application. So we're not the organization that's approving or denying. We have no control over the timeline. We don't have the money to give to people. We're just trying to help people get it in. And so when people are trying to communicate with the center to say, like, hey, I've been waiting 2 months and I haven't heard anything, or I just got denied, why did I get denied? There's only so much we can do. Because we're just in the middle, we're just helping get the paperwork submitted, and then it's in somebody else's hands. So we do have a lot of people who are disappointed, frustrated, angry with us, or misunderstand that we aren't in control of the money. So that is something that we are still trying to figure out on how we can be of service to a population that needs help with rent and utility assistance, but also not make things even more difficult for them by just making it confusing and not being helpful when they need better communication.
Thank you, Siobhan. So a lot of room for growth there, which I hope we will see some changes soon. The next program that I do want to talk about is the Telehealth program. And specifically, I'll be talking about physician telehealth programs. So the physician telehealth program, not mental health telehealth. So telehealth is something that the center started offering as a means to increase access to a primary care doctor in the community. And so the way that it works, a client will come in or call into the center and have them schedule an appointment for you with a partner healthcare clinic. And when it's time for your appointment, you come into the center, they help you get set up with the computer, make sure the audio visual is all set, and then you see your doctor. And the healthcare clinic that we partner with is located several towns over, could be up to 20 miles or even more. So it does make it convenient for clients who have a transportation barrier to be able to just come up the road and see a doctor. One thing I do want to highlight is that clients don't always see the same physician due to the nature of the partnership. So with all of that I shared, what are your perceived strengths and opportunities for the telehealth program?
Convenience.
Convenience is definitely a strength. Increased access for the individual. In our community, once again, internet access is a problem. Yeah, that's a good point. Opportunity, consistency in the continuum of care, tech issues, seeing a different provider.
Trust.
Really good responses.
Yeah. How can you
Awesome.
build that trust and relationship if you're seeing a different person every time?
Yeah. So please continue to drop anything that may come up, but we'll just share what we identified. So the strengths that we identified are, like some of you said already, the ability to connect the client with the physician. In particular, we highlighted that you'll probably see a doctor sooner if you could just get a telehealth appointment, as opposed to waiting for an in-person appointment to come available. Another strength, you do have to come and drive a short distance or get a short distance to see a doctor, which is convenient as opposed to going 20 miles to the healthcare clinic that we partner with. Appointments happen at the center, so if there are any technical issues, we can resolve that. And one of the reasons why they do it at the center too is to avoid that issue of maybe someone doesn't have internet access. So that is a good point that someone considered in the building of this program. And another strength that we identified is the opportunity to maintain a client-staff relationship at the center, because these are typically clients who come in regularly, so then that helps increase the level of personal care that they receive. Some opportunities that we identified, clients do have to come to the center, and we can provide a bus token if someone needed it, but it still might not be the most convenient option for someone. The most convenient option could be that someone wanted to do a telehealth appointment in their home. So that's definitely something to consider. Some clients prefer to see their physician in person, and we've also heard feedback that clients prefer not to rotate. They want to see the same doctor each time, which makes sense. Again, someone said in the chat, building that trust with your provider. How do you do that if you're seeing a different provider each time? And you might see a provider who's not as familiar with your medical records as someone you are seeing regularly. So that is a concern that we have heard. There is a lack of staff support for this service, and we want to highlight this because this is an opportunity to maybe consider staff perspectives on the telehealth process, and maybe there are areas where we can make some changes based on that perspective. And then transportation, it could still be a barrier. Say, for instance, the client had to go see that provider in person, the doctor that they saw on a computer screen. Now they have to go 20 miles to get to their office. And then the other piece about transportation is if the client needed labs or some specialty treatment, we can't offer that. We don't offer that at the center. So that's still something that they now have to think about. How do I go get these labs? And we have to consider like what barriers we might be introducing by asking someone to do that. So thank you all for sharing. We had an awesome time reading your responses, and those are things that we'll probably take into consideration for our evaluation.
I'm just so impressed. Like, all of you are evaluators. This is essentially what we do, is we're thinking about all the different things that could affect numbers or affect people getting the services they need or not. So anyways, we're jumping back into this idea of health equity, and a lot of times organizations on a high level will be like, we're going to do health equity. We're going to come up with a health equity strategy. We're going to embed it into our organization. It's going to be great. Everyone's going to love it. It's going to be awesome. And then the rollout is a little bit confusing. So just as I asked everyone earlier to come up with their own definition of health equity, and the idea of having a shared understanding and a shared language, I was tasked with my colleague to interview staff people who are part of the health equity strategy and doing this work. And we asked everybody, what is the health equity strategy? Do you understand it, essentially? And we got all kinds of answers. We got things as broad as we're creating a healthier community, we're increasing healthcare access, We even got a few people, 3 people, who said, I don't know what the health equity strategy is. And then there were 5 that said the goal is to eliminate disparities. And of those 5, 3 of them are the high-level leaders who are helping implement and teach and educate us all on health equity strategy so that we can roll it out within our organization. So what this told us is that we didn't do a good job of educating ourselves, and we're not all on the same page of this work. And the disconnect between the creation of the strategy and those delivering the strategy directly to people we're looking to serve, like, we all need to be understanding what this is so we can do this work well. I'm going to introduce this clip. There's a podcast called Race to Value I learned about from my boss. This is hosted by Dr. Eric Weaver and Daniel Chipping of the Accountable Care Learning Collaborative. And they interview like top executives, physicians, entrepreneurs. It's about health equity, health value. And this particular interview really struck me because they were talking about social determinants of health and health inequities in marginalized communities. And these 2 gentlemen, Mike Radu and Dr. Greg Fody, they're responsible for creating absolute care. And in my mind, the things they're talking about and the way they've been able to apply the social determinants of health into their organization, they've done a great job of actually moving the needle in a big way and helping people on all these different levels of community and individual. So Sophie's going to play a clip. I hope you enjoy it. It's not quick, but I think you'll like what they have to say.
Sorry.
Is it playing yet?
Sorry.
Okay.
It is playing. I probably didn't share my sound, so I will do that now. Okay.
And social support systems. But I would say the culture of absolute care is, again, we serve a marginalized, vulnerable, complex population. And this population has not received the respect that they should have had from day one in the healthcare system. With that, when they come into our office, we're able to give them that respect. And I mean, it's manners, it's yes, ma'am, it's yes, sir, it's can I get you a drink of water, and the time to spend with them.
Yeah, and this is Mike Radio, and I'll add on to what Dr. Fody mentioned there. He mentioned obviously investing in a culture of trust, which is so critical, as Dr. Fody will talk about, weaving in medical issues, social cycle issues, and social determinants. Building that trust is important to establishing a care plan that members will participate and guide us towards. The other part I'd probably touch on is time. We really slow down our practice. If you think even of the most intense integrated practices, and you've had many of these really talented organizations on your podcast, they're seeing 400 or 500 members per panel size for a practitioner, doctor, nurse practitioner, or physician assistant. Our average panel size is even more intense. We're at 275 on average per clinician. And the second thing we do is add a support team. So we have 2 medical assistants. We actually call them care team coordinators because their job is to make sure that our members understand the interactions that they've just had. As much as we give the gift of time and our practitioners and physicians slow down, they can spend well over an hour with our patients. But even as that time happens and then the doctor leaves the room and folks are trying to collect their orders and the next step sometimes, and we've all experienced this with ourselves and our family upon discharge from a clinical setting, you sort of lose focus, lose attention. So we have the care team coordinator come back in the room, confirm the instructions and the next steps, guide them, whether it's to the pharmacy or lab work or to a specialty referral. And then they have the responsibility around following up and making sure that members are seeking those services, because we know what happens so often in fee-for-service medicine is we all try to do good work. We have primary care providers that are guiding a care plan and good health and evidence-based practice, but then life happens to members, they're busy, they have other needs, and we lose track of their follow-up. And so these care team coordinators, there's 2 of them assigned to every practice, to every person, are responsible for discharge instructions and follow-up. The second and third team members we have is a full-time social worker for each pod and 2 RN care managers. And so we have this robust team that has the time to spend with our members. We actually call them members, we don't call them patients, that work at the direction of our physician and other practitioners, and then can surround that member with the gift of time, both when they're coming to see us in the center or they're out in the community, and be that in meeting them in the emergency room, meeting them in other primary care physicians' offices or out in the community, and I'm sure we'll get into our community model. So besides trust that Dr. Fodi mentioned, I wanted to add the cultural attribute of time.
Thank you, Sophie. So, I mean, can you imagine that many people surrounding members to make sure that they're moving the needle to increase health outcomes for them? Like, that's what it takes. That's what it takes, not a SARA program. And I mean, I can't imagine how they pay for all this, but I highly recommend, if you can't listen to the podcast, do a Google of Absolute Care and see what they're doing, because I think they're doing amazing work.
Thank you. And I do want to just highlight that Ashley said, I like that they refer to them as members instead of patients. And I think that's where it starts, is just shifting your mindset about the individuals that you serve, and how you're referring to them is a part of building trust. So in thinking about this value-based care, the absolute care model that they have, we do want to be very honest and just say that at the center, we do an awesome job addressing individual level needs. We do it so well. And that, of course, is because the center is in its foundational phase. We haven't been open very long, so it would make sense that that's mostly where we operate, is having that impact on individuals. So with plans to expand, we really need to change our mindset about the scope of the center and what we can offer, in hopes that we move upstream in our work, which Siobhan will talk a little bit about what it means to go upstream.
Yes, so this image, I adapted it from an image that was made by the Day Beaumont Foundation and Trust for America's Health. But this idea of the stream, and you're probably familiar with this, but I really appreciate thinking about these things in this way. And that, we're right now, a lot of us, well, not us, but I would say like care providers as a large are operating from this downstream thing, where it's like you come in, something ails you, here's a prescription, here's what you need to do, goodbye. Medical interventions, like we're just come in, here you go, goodbye. If somebody has an emergency and they can't get to a doctor, they're going to the emergency department. We're not giving more to care for the full individual and taking into account the social needs. So then we're moving into individual impact when we start talking about social needs, and we're thinking about people like social workers and community health workers and community-based organizations that offer that direct assistance. So it's not just about what ails you, it's about what are the social determinants of health that are preventing you from before you even get to the doctor's office. So then moving on upstream, where we really want to be, because once you're upstream, what you do at the top kind of affects everything else down the stream. I'll say downriver. It's those policies, those laws, the regulations. Why civic engagement is so important. People don't get it, but like all of these things affect you on an individual level. So in order to improve individual needs, we have to improve those community conditions, and you have to be thinking big picture upstream, and tasking our legislators and our electeds to do a better job of creating laws and policies that keep us healthy. So then areas in which we can make an impact at the center. We've heard from people based on follow-up surveys, based on what staff have heard from clients that they've seen, that there are some things that are popping up in the community that people need that we aren't able to provide. And if we want to increase life expectancy and close health disparity gaps, we have to take a hard look at some of these community needs. So what we have are like housing issues, childcare, healthcare, transportation, and education. So we can keep on providing these individual services, but we have to start really taking a crack at how we can make dents in these bigger issues. And here's a quote from the chairperson of the Population Health Board Committee at Spectrum Health Lakeland, Dr. Ken O'Neill. So he said this in an interview I had with him, and I thought it really moved me or helped me picture the work we're doing at all these different levels and how we have to work on multiple levels in order to move the needle, not just get hyper-focused on like individual needs. So he said, I understand that improving processes actually helps people. So if I'm a physician, I can help one person, I can help one diabetic get better. But if I can get a process in place that can help 1,000 diabetics, then I've helped 1,000 people. And I might not know them, but I think that that still is motivating to me to make systems better and fairer and more equitable.
So we shared a lot of information with you all, and this in no way encompasses everything that we've learned as evaluators in Spectrum Health Lakeland. But we do want to share just a few lessons that are super important to us that we've learned so far. And that first lesson is establishing shared definitions and how that leads to shared understanding. So just thinking back to the slide where Siobhan and Nathan asked if employees understood the health equity strategy, and a lot of people said no, they didn't understand how their work related to the health equity strategy. So there is some opportunity for education there, an opportunity to create those shared definitions so that people understand it better. Another lesson that we have learned is the importance of creating an action plan. So it's not just enough to make a commitment, right? You have to think about what comes after the commitment. What are the next steps that we need to take to make this happen? What are the resources that we need to collect? Things like that. Those kinds of actions, they should be written down and in order for them to be properly executed. And the last thing we want to share is the importance of being culturally responsive. So that looks like considering your community and whatever action plan you put together. Consider their responses and consider their questions. Consider any tensions that might be involved in the work that you're embarking on, and how you'll respond to these things, and making sure that you're sensitive to the community, and also being mindful of your impact. So just taking care that you're not doing more harm than good in the community that you're looking to serve. And just as an example of us trying to be culturally responsive in our work, we do use the equitable evaluation framework as outlined by the Equitable Evaluation Initiative. And we also try to incorporate culturally responsive approaches in our evaluation and assessment work. So these are, again, resources that we can share with you later on if you're interested in them. We'll have that available to anyone who might want that. So speaking of resources, everybody needs something to get it done, right? So if you had access to any resources that you needed in your particular community to solve the issues in your community, what would you need? What is that resource and what does it look like? Drop in the chat for us what those resources look like for your community. I'll start and drop my resources. And we'll give everyone a minute to drop their resources in the chat as well.
More nursing staff per shift, willing people.
That's good.
Affordable housing for all ages, not just seniors.
Yeah.
Amen
That's
to that.
Mm-hmm. Decent paying and engaging jobs. Hope. That's good. That's good. All right. Please continue to drop your resources. We'd love to read about them. And while we cannot provide you with some of the resources that we see in the chat, we do just want to share a few resources that we think is helpful for those who are interested in addressing social determinants of health in your community. And I will plug again the Race to Value podcast. If you want the link to the episode in which we shared the clip, we can provide you with that. But these are just a tiny, tiny fraction of the resources that are available.
And we also want to plug the fact that like our hospital system is a non-for-profit or nonprofit. So they're required by law to complete a community health needs assessment every couple of years. So I would highly recommend looking into what hospital systems are around you, if they're nonprofit, and see what reporting they've done on what the community health needs are. Because that's essentially what it is. The community health needs assessment is they're going into the community where the hospital resides, where they're serving, and finding out what are the big barriers or big needs for people there. And that can be a great insight, and it can be a great place to start. But then you have to push further and really include community in building what your strategy is going to be. You cannot do this work just in your own little silo of an organization. You have to bring people in to be a part of the conversation.
I know that we're over time. If there is maybe one question, we could take a question, but then we'll have to wrap up.
I do want to say that I know that a lot of us work in situations where we have to have a report, and boards, they want to see numbers, grant applications, they want to see numbers, but also know that they want to hear stories. Stories are really powerful, and you cannot do this work on numbers alone. And this is how we hold people accountable, is by sharing the full picture of what's happening. You know, the numbers, the stories, the interviews, put it together and advocate for what needs to be done.
All right, I think if there are no questions, we'll go ahead and close. We just want to say thank you to you all for joining our community of learning. And we have learned a lot from you all as well, so we appreciate that. And if you would like to hear from myself or Siobhan, if there's anything that you need, please reach out. We're happy to listen and to receive whatever it is you'll have to share.
Yes.
So thank you, everyone.
Thank you.
Thank you all so much. I love the way you all talk about research, because I think the stories help root it in reality for me. And it takes it from being this giant thing to like, man, that could be my dad, that could be my grandmother. Like it just gives it such life. So just thank you, ladies, so incredibly much. And I miss both of y'all's faces in Tuesday morning 9 a.m. shenanigans. So thank you all so much for being willing to come. And just to each and every one of you, our participants, thank you all. Our speakers, our panelists, our keynote, our workshop leaders. Y'all are like real MVPs out here changing the world on a Friday. So just know that we thank you. We appreciate you. For those of you who attended, please help us out by filling out the survey that was dropped in the chat. We just thank you all so very much for participating. And again, we want to just thank our sponsorship, Spectrum Health Lakeland, Mercy Health, Mercantile Bank, Urban Core Collective, Genetech, and there is one more, and this is I Chase Children, and my brain don't move as fast as it ought to. I'm forgetting one more of our sponsors, but again, thank you all so much, and just thank you all for showing up, and showing up in your authenticity. Thank you. Has not been lost on us, and we just truly appreciate you. So please keep an eye out for upcoming programs. I know March we will be tackling colorectal cancer, and just awareness on that and how it impacts Black and Brown communities. I know myself that that's something that impacts my own personal family. So I'm excited to see how we talk about this and go after it. In April, GRAHI will be celebrating its 20th anniversary as an organization with our gala. So again, please keep your eyes peeled. And then in May, I will be back because May is Mental Health Month. So we're going to make it magical in May and get y'all together from the head up so that the head from the toes up can be all right. So again, thank you all so much. And we just appreciate you all and pray that you have a blessed and wonderful day. To those of you out in Facebook Live land, thank you all for rocking with us. Even if you didn't see it today and you see it 10 years from now, I hope it bless you. So again, we just want to thank you all for just showing up. So have a wonderful afternoon.